chronic ulcerations. So the Rakta Mokshana and Pitta Rakta Shamana Chikitsa are highly indicated in a chronic infection of the cornea. So if the patient is presented with chronic keratitis, means if a cornea is involved, then that will take time because there is no antibodies from the body will reach there because it is an avascular structure. So if an ulceration happening in the cornea, usually it will take a chronic course to heal. So up to the complete healing of that corneal ulcerations, we have to continue the treatment. So continue the Jaloga or continue the Kritapana or Virejana, just like the Pillaroga. So we have to manage or do more frequently up to the complete remission of the ulcerations. And these are the conditions in which the Rakta Mokshana is mentioned in the eye disease. Means Puyalasa, that is complicated Arma, Savarna Shukla, Pittaja Timira, Kavaja Timira, Abhishanda. All these conditions, the Acharya clearly mentioned the Rakta Moksha. Means in some conditions, if the patient is not responding to the Snigdha Kriya or Ushna Kriya or Shida Kriya or Ushna Kriya or like that, means if Rakta is having a property of Rasa Dhatu and Rakta Dhatu. The Rasa is of Shida, Rakta is of Ushna. So if a patient is not responding to Shida, maybe due to the involvement of Rakta Dhatu. If it is not responding to Ushna, that may be due to the involvement of Rasa. So the Rasa and Rakta, they have a thin boundary. If the patient is not responding to Shida and Ushna, that means the Rasa and Rakta is equally involved. In that condition, the proper treatment to remove the Rakta as a whole. In that condition, Rakta Moksha is a very good line of management. So these are the site mentioned, that means Steroid Netra Vikareshu, Lalade, Mokshate, Serum, Apangam, Upanasya. In some conditions of diabetic retinopathy or some conditions of acute congestive glaucoma, we have to manage the condition with this Siraveda. These are the some indications of Jaloga, that means Pitta Dushta Rekta, Grithita Rekta, Avagata Dosha, Toxtita Rekta, Sukumara Purusha Toda, all these conditions that we have already discussed. If the patient is having severe photophobia, that we should understand the involvement of Rekta, then go for the Jaloga. And these are the Pitta Rekta Shamana Chikilsa, that means Vidalaga, the medicine Vidalaga that we are adopting is the Mukkadi Yoga and Kshira. The Mukkadi Yoga and Kshira, when the Rekta involvement is happening. So if it is Pitta Kapha involvement, then we can change this Mukkadi Yoga along with the Dhanyamla. Accordingly, we can change the means the media that we can change, or the Shiroleba. That means Shiroleba is also means all this Vidalaga and Shiroleba are very much useful to reduce the Abhishanda that we have already discussed. Abhishanda is not at all happening only in the eye; it is happening in the Urdha Chaturgata. So Sarva Urdha Chaturgata Srodasa. So the Srodas, Abhishanda of the Srodas is happening in the Shira. So to pacify that Abhishanda, Shiroleba is must. Along with the Vidalaga, we can start the Shiroleba. This is clearly in some cases of diabetic, the pre-proliferative diabetic retinopathy. That means the whole the retina is having some sort of edema. In that condition, we can start the Vidalaga and Shiroleba in the first line of management. So the Shiroleba, that is Ashtimadu, Rekta Chandana, Daru Haridra, Kuluji, Trifala, Gairika, and the Kashaya. Make the kashaya and mix powder and make paste. So this is made into the kashaya and churna, then make as a paste, and we can go for the Shiroleba. So these are the some yoga that is mentioned for the Mukhaleba, and not going to the details of that condition. This is a procedure which is doing for the Mukhaleba. That means Shiroleba, Mukhaleba, Vidalaga are the three methods that we can start as a combined manner to reduce the Abhishanda nature in the Shira. And in the Anjana Prayoga, that in the corneal opacity, that in the first we have mentioned that in a corneal ulcerations we cannot go for the Anjana karma, but in corneal opacity we can go for the Lekhana Anjana. Means opacity means there is no sign of Pitta involvement, there is no sign of infection, only the opacity. So to relieve that opacity, it is the ultimate, that is corneal opacity. If it is nebular, macular, locum, any type of opacity, our strength is to start with the Lekhananjana. So Acharya mentioned that Raga Asur Vedana Shanto Param Lekhana Manchanam. So if the patient is having, get rid of the redness, watering, pain, then only start with the Lekhananjana. So the redness, watering and pain means it is an acute inflammation. So after subsiding the acute inflammation of the cornea, we can start the Lekhananjana. These are the types of Anjana, that is Lekhana, Ropana and Drishti Prasadana. Here mentioned that the Lekhananjana is especially for the Kaphaja predominant condition, especially the corneal opacity. The Ropana Anjana, that we can adopt in conditions like Pitta involvement, and Drishti Prasadana, that is we can start for the daily practice, or we can advise for the daily practice. So it is the specific indications, and Acharya mentioned that in the Avarna Shukla or in the Shuddha Shukla or in the corneal opacity, we have to start with the Lekhananjana. And as we know, I cannot tolerate Lekhananjana for a long time. But the corneal opacity need a long-term Lekhananjana for the complete removal of the opacity. So in that condition, Acharya mentioned one treatment principle in the management of Shukla Roga, that is Nityam cha Shukleshu Sridam Yathaso Panecha Marshecha Kridam Vidatyat Na Hiyade Lebda Velastadanda Tikshnanjanadrik Sadadam Prayuktehi. So if we have to adopt the Tikshnanjana for a long time, give Panecha Marshecha Kridam. That means oral intake and Pradimashanasya with the Krida we have to give in between. Otherwise, the patient cannot tolerate the Tikshnanjana for a long time. So if we are managing a corneal opacity, then start with the Lekhananjana, then give a break, and in that break time, advise the patient to take Kridapana and Pradimarsanasya with the Krida. Here the specific condition with the Krida Pradimarsanasya is indicated by the Acharya Vagbhara in the management of Krishna Roga. So this is the management of corneal ulcerations that may be due to some injury. We can adopt the Pindi, just manage the condition with the Durva Krita Aschodana and apply over the Pindi for the 6 hours. That in the previous class we have mentioned that the corneal epithelium will grow completely with the 6 hours. So bandaging should be done minimum for 6 hours. So these are the medicines which is our option for managing the Shuddha Shukla or Savarna Shukla, that is Manjishtadi Kashaya, Guluchadi Kashaya, Padola Muladi Kashaya, Padola di Gana Kashaya, Padola di Krida, Vibhati Churna, and Kaishwara Kukulu. All these medicines that we can adopt in the management of Savarna Shukla Chikilsa. Here there is no Krida in the local application is mentioned. We can adopt for the Jaloga or Lebana only in this condition and start with the Sega. So the progression of corneal infection. So as we know, the description of corneal diseases in Ayurveda. So if a long-standing corneal infection, that means neovascularization will happen. That means as we know, the cornea is not having blood. The neighboring vessels, that is the perinimbal vessels, will start perfusing its content to the site of inflammation. If that is not at all sufficient, then the new blood vessels from the perilimbal area will enter into that ulceration, and that condition is termed as the neovascularization, and it is the Sira Shukla. So Sira Shukla means it is a very chronic one, and as per the Ayurveda itself, it is an Asati Vyadhi. If it is not treated, then it will leads to the total or eyeball infection. That means total infection of the eyeball will happen. That is the Pakate Shukla. So when we assess the corneal diseases in Ayurveda, it can start from a simple injury. So the simple injury, then there will be an infection. That means first the inflammation will happen, then the infection will start. That infection will go to a chronic stage, and that chronic stage will go into an entire eyeball. That is the endophthalmitis. That is the Pakate Shukla. So In this condition, only the initial stage of the corneal ulcer and the condition where the complete corneal ulcer is healed, that is the corneal opacity. These are the two conditions which is manageable by Ayurveda as per our Acharyas also. So that we have already discussed, that is injury. If it is not deep, then heals without a scar. And if injury it is deep, then heals with a scar. These two conditions are easily manageable, and the infections, the early stage is also manageable. So these three conditions we can easily manage in our OPD. So if injury is not deep, then we can go for a Sadhyavarana Chikitsa if it is a readily happened type. If it is injury, it is deep, then heals with a scar. If it is scar is remaining, then start for the Lekhananjana, and the infection is in the early stage. That means is that corneal neovascularization, etc. has not happened, then go for the treatment that is for the Trivrudvarina Pakum, Kshadashukle Khradam Pibed, Siriyatu Haryat Rektam, Jaloga Bishavarina. Like that, we can manage the condition. And so now we have covered the line of approach of an ocular surface disease, then corneal disease, and next is the iridocyclitis, means the condition which is commonly presenting in the OPD is only described in this presentation. So in iridocyclitis, as we have discussed in the earlier class, it is this nutritive part of the eye. It is the uveal tract. The total nourishment of the eyeball is happening from the uveal tissue, either by the circulation or by the aqueous humor. So the uveal tissue and aqueous humor are responsible for all the nutrition part, and the Rasa Rakta Dhatu are the dominated site here, because this circulation is entirely or totally coming from the systemic circulation. So the systemic circulation, the vitiation of the systemic circulation, especially the Rasa Rakta vitiation, is the samprapti similar to that of Kushtaroga or Visarparoga. So if a patient is having a chronic, as we discussed, this iridocyclitis is actually not a disease of eyeball. It is a problem of system. Means it may be due to an autoimmune disease, or maybe due to some tuberculosis, or maybe due to some diseases originated from the allergy. Like that it will happen. So the management required in the system, not only in the eye. So we can give symptomatic management in the eye. We cannot assure the patient that the local treatment is sufficient for managing a disease like iridocyclitis. So in the systemic samprapti, we have to adopt, or we have to understand the Kushta Visarpa Chikitsa in the management of iridocyclitis. So the diseases manifesting iridocyclitis is a systemic, and it is in most of the cases it will be recurrent. So if a patient got infected with iridocyclitis, and within 6 months, I think normally the duration that we have observed the OPD is after 6 months or within 1 year, the patient will have the second attack. And if a patient is having immunocompromised or having autoimmune disease, then definitely that will going to recur. So the systemic involvement, recurrent nature, and autoimmune nature is pointing towards the management or understanding the samprapti of Kushtaroga. So in the Kushtaroga Chikitsa, Acharya clearly mentioned that the Snehabana, Shodhana, Rakta Mokshana, Parishega and Lebana are the effective treatment to manage the condition. So here the Parishega means it is the Netrasega. Lebana means it is the Vidalaga. So the Lebana, should not be limited in the eye, that we have to adopt in the Shira and Mukha. The Shiro, Mukha and Netra Lebana is very much effective in this type of condition. So only after Rakta Mokshana and Koshta Shuddhi, this local treatment can be done. So in the Agra Chikitsa of Kushta is the Vadolpana, it is Sarpi, Kafottara, it is Vamana, and Pittottara is Rakta Mokshana and Viryachana. So in the Kafottara means actually this Rasa Rakta involvement is very much high, so we cannot consider the only involvement of Kapha dosha. So here the Vamana is not at all practically not using. Other two, that is a Sarpipanam, Rakta Mokshana and Viryachana, that we are usually adopting in the management of iridocyclitis. So in Kushtaroga Chikitsa, Acharya mentioned that Pakshar Chardana Napubeya Masan Masaj शोधना नथ्यवस्थात् शुद्धिर्मूर्धनस्य त्रिरात्र षष्ठे मासे मोक्षणं च. So this is a chronic condition. In the Kushtaroga Chikitsa, Acharya mentioned that we have to do frequently or with time period also. Acharya clearly mentioned that masad shodhana means virechana should be done within every month, and shuddhi murtanasya triratra means pradimashanasya should be done, and shashte masam within 6 months rektamokshana should be done. So in a case like iridocyclitis, we have to follow, means with a single sitting of Ayurvedic management, if we cannot assure the complete relief of the patient or complete remission of the condition, we have to convince the patient the systemic involvement in a conditions like iridocyclitis. So in the Netra Chikitsa, it is Shodhana, it is Virechana and Anulomana medicines, Lebana means Vidalaka, Mukhaleba and Shiroleba that we have already mentioned. Parishaka means Netra Sega. Netra Sega can be given as a Manjishtadi, Kshira Sega or Utpaladi, Kashaya Sega, anything that we can adopt, and Rekta Mokshana. So that means that already we have discussed it. The iridocyclitis patient will present with severe photophobia and watering and redness. So to manage the immediate management of that condition, we can go for the Rekta Mokshana. And Vasti is also a choice of treatment. That means in the Kushtaroga Chikitsa also is a Vasti is mentioned. So here we have to think about the Vasti treatment, means Panchatiktaka Kshira Vasti is a good management of this type of recurrent iridocyclitis. Okay, so I think the condition which is presenting as iridocyclitis can be managed by understanding the Samprapti of Kushtaroga. And in the glaucoma, I am not going to so much detail in the glaucoma, the high IOP is the strongest risk factor. It is only a risk factor. The elevated IOP is not a condition of glaucoma that we have already discussed in the last class. And here we have to adopt the Samprapti of Uttara Chikitsa and Shofa Chikitsa. So the Uttara Chikitsa, Uttara Roga Samprapti is the main part that we have to understand for the management of the case like glaucoma. So Uttara Chikitsa mentioned that Roga Sarvevi Mandakno Sudara Mudaranitu. So the Mandakini. So Agni Mandya along with the Srodorotha is the key factor playing in the Uttara Roga Samprapti. The same thing happening in the glaucoma also. So here also there we have to consider the involvement of Amadosha. So first start with the Pajana, Deepana, Lenkana as a treatment of choice. So here may be required the Panchakola Takra, may be required in the first stage in the management of the glaucoma to get rid of the Srodorotha. And in the Samprapti, this Nidana, Ama Sanjaya, vitiated normal doshas accumulates to obstruct the Urdhva Atha Srodas and localize the Tokmams and Shofa will be developed. This is a Samprapti of Shofa. And in this condition and in the management of the Uttara Roga, Acharya clearly mentioned that Nityamena Virejeda. So in the management of glaucoma, we have to give the Virejana drugs, not for a single time, but for a daily. Nitya Virejana should be given. So for that, usually we are giving the Padola Muladi Kashaya. Padola Muladi Kashaya is a Virejana medicine. So when we are thinking in a scientific way also, the Koshta or the hydration of the system is having a high influence on the aqueous humor secretion. So if we are doing the Virejana daily, then actually the aqueous humor production will be reduced, as well as the reabsorption from the aqueous humor. That is, a water reabsorption from the aqueous humor will be improved by the episcleral venous. Means the episcleral venous pressure and episcleral content, means the constituent of the blood, that will be also influencing the aqueous humor production as well as the drainage. So when we are thinking scientifically also, it is correct. Give Virejana as a Nitya Virejana up to the control of the IOP. And don't give any type of Khrida or Rasayana here. Just go for the Lenkana, Deepana and Pachana. So Nitya Virejana along with the means Deepana Pachana are the first line of approach of a patient having elevated IOP. So in ankle closure glaucoma, it is an ocular emergency. So that we have already discussed. Ocular emergency means the Rekta Mokshana is the first and foremost line of management. And in chronic condition, so means in open angle glaucoma, that is sclerosis of canalochelum, up to the control of IOP, then go for the Tikshna Nasya, Tikshna Anjana and Takradhara along with the different type of leba plus Viryachana. So in Tikshna Nasya we can go for the Shadbindu Taila or Swarasa Nasya or Arishta Nasya in that condition, and Tikshna Anjana with the Siddhamanashalati Anjana or Samudra Fenadi Anjana that we can adopt, and Takradhara is also Kafavada Shamana medicine. Then we can go for the Takradhara and various type of leba, that means in the Mukha leba, Shiro leba and Nether leba that we can adopt to get rid of the Srodharodha in the initial stage up to the control of IOP. So when the IOP is under control, that means the IOP is totally dependent upon person to person, and that IOP is termed as the target IOP. So if we have obtained the target IOP, then only our aim is different. Then after the controlling of IOP, our aim is to strengthen the retinal neural tissues. So to give the support of neural tissue, it is nothing but Rasayana, to promote the regeneration of the damaged retinal fibers or to give more strength to the already existing fibers. Our regeneration medicine is the nothing but it is Rasayana. So as far as the eye is concerned, the Rasayana is the Tarpana. Tarpana means Triptikaram Karmam. That is, it is the regeneration capacity. It is the Brahmana Karma we can adopt. So the Tarpana, Rasayana and Brahmana Nasya, these are the three medicines that we can adopt in a patient having normal IOP but having visual field defect or retinal nerve fiber damage. So the management of the IOP should be discussed in two headings. First, up to the control of IOP to the target level, then manage the or to repair the conditions of retinal nerve fibers. So these are the some formulations, that is Nagarakrita, Nilikrita, that is Narayana Churna and Gudardhaka. I am not going to the details of these conditions. And last, now we are moving to the retinal diseases. So in the retinal diseases, normally it is happening in the vascular, inflammatory, neurological and degenerative conditions. So that's we have discussed the drishti. Drishti means it is a wide term starting from the precorneal tear film up to the occipital cortex. So all these type of diseases, that means the retinal diseases, definitely that we have discussed, that is a painless condition, and the patient they will present with the diminution of vision. So the diminution of vision in Ayurveda, it is nothing but a drishti roga. So the management or the presentations in the drishti, the retina, that should be taken as the diseases of the retina. So here the dosha, that is deeper dhadus are involved, that is Rasa, Rekta, Mamsa, Medas, and up to Asti level it will be involved. And we have already discussed that is Asti Asrita Patala as the Patala which is supported by the Asti. So we have to consider the role of Vasti in the management of retinal diseases. So in the retinal vascular disease, the commonest form of retinal presentation is the retinal vascular disease. So I am exploring that mainly in this presentation. So the involved dosha is the Kapha, Pitta and Rasa, Rekta are the main condition, and here also the central retinal artery, it is directly coming from the internal carotid. So we have to consider the systemic pathology also here. So the central retinal venous occlusion, artery occlusion, hypertensive retinopathy, Eales disease, diabetic retinopathy, all are coming under this retinal vascular disease. So the vascular disease means it is a common among retinal disease, that is high prevalence of diabetes mellitus, hypertension and cause changes in the retinal vasculature. And the pathological changes involve the vasculitis, occlusion and retinal neovascularization. All this that we have discussed in the last class, the peculiar features of retinal blood circulation that we have discussed. It is having dichotomous branching, arteries are superficial than veins, and the vessel wall is transparent, strong pericytes, all are applied in the particularly in the vasculature of the retina. So this is a picture which is showing the extensive bleeding, that is Eales disease, that means this tomato splash appearance. So here the blood is leaked. So in that condition we have to manage this as two methods. That means either by the Urdhva Rektapitta Chikitsa or by the Vadashonita Chikitsa. So the pathological factors means the Rekta Dushti Nidana and Netraroga Nidana both are contributing to the retinal vascular diseases. So the condition, the three factors will play a role in the management of retinal vascular disease, mainly the Netraroga Nidana, Vadashonita Nidana and the general Rekta Dushti Nidana. So the management, we have to think about the Urdhva Rektapitta Chikitsa, Paitika Timira Chikitsa, Pittaja Abhishanta Chikitsa, and Vadashonita Chikitsa. So the Netra Kriyakalpa, the sekam that is mainly we are advising is the Utpaladithara, Manjishtadithara, Yashti Kashaya, and Shveda Lothra Kashaya. All are these medicines are described in the Ashtanga Hridaya, either in the Kshadashukla Chikitsa or in the Timira Chikitsa. And Shirasekam with Aragodadi Kashayam, Manjishtadi Yoga, and Utpaladi Kshiradhara can be adopted. And in the Aschodana, Chandanadi, Samudrafena with the Stanya, Eshti Lothra with the Krita, and Anjana with the Jadi Mukuladi, Chandanadi, Elanar Korambu, and Vitalagam the Mukkadi Yoga. So if a patient is coming with this type of retinal vascular disease, according to the type of bleeding and chronicity, if it is a fresh bleeding, then we can adopt the Sadhya, means Urdhva Rektapitta Chikitsa can give the Shida Kriya to reduce the bleeding. And if it is a chronic one, then there will be changes in the retina. That means changes the retina means the retina will start absorbing the blood or the vitreous. That means the blood will attain in a boat-shaped hemorrhage, or there may be some non-perfused area. That means there will be some area which is not receiving blood. So we have to consider that ischemic area also. So the Shida Kriya, if you are constantly giving the Shida Kriya, then already the part which is in the ischemic stage, that will be very much damaged further. So we cannot adopt a constant type of Shida Kriya in a chronic retinal vascular damage or retinal hemorrhage. So if it is started immediately by the fundoscopy, Dr. Praveen in the last class explained, if the fundoscopy, if it is a fresh bleeding, then start the Rekta Stambhana Marga. And if it is a chronic one, then the color of the blood will be changed, the shape of the blood will be changed, and we can clearly see the non-perfusing area or the ischemic area, and we have to give the importance to that ischemic area along with this bleeding. So cannot go for a constant type of Shida Kriya in a long-standing or a chronic retinal damage. So the Nasya is very much important for arresting the bleeding. That means Stambhana Nasya we can give in the bleeding stage, or if it is actively bleeding, we can go for the Stambhana Nasya, and the Shodhana Nasya in some sort of occlusions. That means if the retinal ischemia is there rather than a bleeding, then go for the Shodhana Nasya. So if we are wrongly practicing a Shodhana Nasya in a bleeding stage, then the bleeding will be worse. So the yoga means Siddharandadi Nasya or Madhugadi Taila, or the medicine like Durvadi Swarasa, that is Durva Swarasa, it is also very much important in the management of retinal vascular diseases. And the retinal degenerative conditions, when we are going to the details, it is recurrent in nature and it is irreversible in nature. And the treatment approach is mainly the Tridosha Shamana and most consideration to the Vata Pitta. So I think I am not going to these details because the coming classes they are handling with the refractive errors, then some sort of diabetic retinopathy. All other sessions are yet to start. So in a condition like pathological myopia, it is nothing but it is a degenerative condition. In that degenerative conditions, a lot of damage of the retina will happen. In that condition, we can start with the Tridosha Shamana and Vata Pitta Shamana. Vata Pitta Shamana means that is a Kridavana. We can start the Kridavana and Rasayana for the preservation of the vision. So these are the conditions, that is the ARMD. ARMD means the age-related macular degeneration. In the first picture itself, there is no bleed. So there is no bleed means the condition is having less pitta involvement. Less pitta involvement, then means there will be the pathology mainly due to the Srodha. Here the drusens are coming. The drusens are mainly due to the Srodha is occurring. So in that condition, then we can adopt the Tikshanasya. We can start with the Tikshanasya for resolving the Srodha. So in the next, the lower side pictures, you can see there is a bleeding. In that condition, it's wet ARMD. So the wet ARMD means it is bleeding. So don't try for a Tikshanasya in a case of wet ARMD. So in that condition, we have to, our aim is to arrest the bleeding and to promote the bleeding and promote the retina to absorb or promote the vitreous to absorb the bleed. Then only we have to correct the underlying degeneration. So if a patient is diagnosed with ARMD, as per Ayurveda, we have to consider where it is Vata Kafaja or it is Vata Pittaja. Means Vata will be there because it is a degenerative condition. So if it is a Vata Kafaja, then we can easily start for the Tikshanasya, no problem. If it is Vata Pittaja, then Tikshanasya is strictly contraindicated. So like that, we have to assess the fundus in the Ayurvedic dosha analysis and then adopt for the treatment. So this is retinitis pigmentosa. You can see there is no bleed. There is no exudation. It is completely degenerated. Degenerated means it is very pale. And when we see the optic disc, it is very pale. That means it is an end stage. It is an end stage of retinitis pigmentosa. That means it is optic atrophy. So atrophy means it is a Vata Pradhana condition. So Vata Pradhana condition, then we can easily go for the Snigdha Kriya. That means Brahmana or Brahmana Nasya or Rasayana or Tarpana. Anything that we can start. But if it is a Vata Pittaja, just like the previous conditions like wet ARMD, if we are trying for a Tarpana, then definitely that condition will going to be worsened. The Tarpana is strictly contraindicated in a conditions having Pitta involvement or Kapha involvement. So in the dry ARMD or wet ARMD, don't jump for the Tarpana first. Go for the Srodha treatment first, then only think about the Tarpana in the later stage. But in conditions like retinitis pigmentosa or optic atrophy, we can directly give the Tarpana, nothing to happen. So this is a clear-cut optic atrophy. In this type of condition, actually, the Acharya clearly mentioned that it is an Aupasargika Linganasha. It is somewhat similar to the optic atrophic changes. It is asadhya. So many of the conditions mentioned by Acharyas are asadhya in nature. So we cannot ensure the patient for preservation of vision like a condition which is presenting in this way. So our treatment, why we are doing this type of treatment? So what is the logic behind the treatment schedule that we have decided or we have developed for a patient that should be confident to the doctor. That's the only thing I want to convey to you. So why you are doing this treatment? Samorchana kind of management is history of the patient.
Hello, sir. Hello, sir.
Hello? Hello, am I audible?
Hello? Now it's audible, sir. But yes, sir. Yes, sir. Now it is audible. But right from the beginning of this slide onwards, it was not audible.
So have you heard about this optic atrophic presentation that I have made?
No. Just the beginning only.
Okay. So in this slide, I want to convey the prognosis of the patient. So before starting the treatment, we have to ensure the
Hello?
why we are giving the treatment to that patient, or what is the line of treatment that we are planning. So to understand the line of management, we have to ask the patient by his history, by the presentation, and all the necessary investigations. So necessary investigations will help us to give the prognosis. So just ensure the patient about the condition. So if a patient presenting like a fundus like this, we cannot see, or we cannot accept a vision more than counting fingers. So if a patient is presenting with the counting fingers, and when we are assessing the retina, if the optic atrophy is there, then we cannot manage, or we cannot ensure a full vision to the patient. So this type of condition is already mentioned by our Acharyas as an Asadhya Vyadhi. Then we cannot ensure the complete restoration of the vision. So start the treatment according by ensuring the prognosis to the patient, as well as make the protocol by assessing our confidence, or what are the factors that we have considered to assess the, or to make, or to schedule the protocol to that patient. That should be our confidence. So this is a case of cataract. It is one of the most common presentation. So in Ayurveda, it is considered as a Kavacha Kaja. Kavacha Kaja means this is a particular picture from the OPD. It is a color of the drishti. It's a white in color, Shankhavarna. It is a white in color. If that progresses, then it is going to the Kavacha Linganasha. Kavacha Linganasha is a surgically curable condition. We cannot ensure it is a medicinally curable. But Kavacha Kaja is a condition which can be managed, but it cannot be cured. It can be managed only. It is a Yapi Vyadhi. So we can ensure the patient to regain the vision only, but it is very difficult to restore the complete vision. So if the patient is not at all interested for the surgery, or the patient is not fit for the surgery, then we can start the treatment in a condition of Kavacha Kaja. But if we cannot treat a patient of Kavacha Linganasha, because our Acharya is also mentioned that it is a surgically curable condition. So in the Drishti Roga Chikitsa, Acharya give a lot of options. That is Dosha Nirodhana Chanega Shastam Sneha Asra Visravana Rega Nasi Upacharya Danchana Murtha Vasti Vasti Kriya Tarpana Lepasekai. So here Acharya gives opened a lot of treatment procedures. That means Snehavana, Rektamoksha, then Virejana, Nasya, Anjana, Shirovasti, then Pakvashyavasti, Tarpana, Leba, Seka, all are mentioned. But these all treatment are not necessary for a single patient. But a single line of, in many of the conditions, a lot means frequent sitting of the treatment may be required. So it is Nega Shastam, Na Ega Shastam. That's one line of treatment will not be sufficient. So these are the gateway to manage the Drishti Roga in Ayurveda. So assess the condition, where the Tarpana should be done or where it should not be done, or where the Vasti Kriya is necessary, where the Shirovasti is necessary. Accordingly, we can manage the condition. So these are the medicines which is mentioned in the Drishti Roga. That means this session will be covered in the later classes. That is Ilanar Kodambu, then Shanmakshika Yoga, Akshabijadi Kulika, Tutthanjanam, Ekat Pipilyanjana, Kanasendavadyanjanam, Jadi Mugaladyanjana, Siddhamanashilati, Vasanjana. All these are various type of medicines. It means the maximum yogas are mentioned in the Drishti Yoga itself, and the maximum Krita yogas are also mentioned in that chapter only. Siddha Vasanjana is particularly for Vata condition, and Shanmakshika Yoga, it is especially for Kafacha condition. Ilanar Kodambu is for Pittacha condition. So like that, we have to assess the dosha and prescribe the anjana. So these are in management of the retinal diseases. Vasti has a great role. That means indication is in the Vadiga, Drishti Roga or Drishtigata Roga. Samanya Chikitsa itself, Acharya mentioned the importance of Vasti, and it is the best treatment in management of Vada Vyadi and also better treatment for disorders of Marma. Means Marma Bigada, the main treatment is the Vasti. So, as we know, the Shira is one of the three marma. So we can consider as it as a marma sthana. That can be done in any age for elimination of doshas. Means the vasti can be done from the child. Means as matra vasti can be done in the child as well as in the old age. The vasti can be done. Ultimate treatment for kopa prasara and sthana samsraya vada. So these are the some vasti yoga which is usually doing in the retinal diseases. Just I am mentioning the name, that is Madhudailika Vasti, Eranda Muladi Vasti, Dipancha Muladi Vasti, Sthiradi Yapana Vasti, Kshira Vasti, Pelaguluchadi Vasti, Panchatiktaka Vasti, Lekhana Vasti, and Yoga Vasti. So we have already in the previous slides also we have mentioned about the Panchatiktaka Kshira Vasti. It is very much effective in the iridocyclitis, whereas the Eranda Muladi Vasti, it is can be given in as a Yoga Vasti in the management of age-related macular degeneration. Means it is age-related. So it is we have to do the Chakshushya Rasayana as the Chakshushya Vasti. That means the Madhudailika Vasti. So we can accordingly, means in the retinal degenerative conditions just like retinitis pigmentosa, because it is very much deeper dhadus are involved. So the deeper the dhadus are involved, the Vasti having means Asthyaasrita dosha can be managed with Vasti only. So in that condition, a lot of Vasti are applicable in the management of retinal diseases. So these are the, I am not going to the details. It is Madhudailika Vasti, Eranda Muladi Vasti, Sthiradi Abana. This is Sthiradi Abana Vasti. It's usually doing in the pathological myopia also. Means we know the pathological myopia means it is the axial elongation of the eyeball. This elongation means the structure is varying. So the structure is varying means there will be definitely the Vada dosha will be involved. So if the Vada dosha is evident, then we can opt to the Vasti as a best line of management. So we have mentioned about the Yapya Netra Roga. It's a lot of diseases are Yapya, mainly the Kaja are Yapya. In the Kaja, we can understand as the immature senile cataract as the Kafacha Kaja. So in that condition, we have already mentioned that Yapya Avastha, that means we can preserve the vision and up to certain extent we can improve the vision also. So Acharya clearly mentioned that Chakshurakshaya Sarvagalar Manushya, that means it is the importance of Netra Samrakshana. That means the prevention is better than cure. And here there's the preventive ophthalmology mentioned. That's a Trifala Rudira Sudra Vishuddhi, Manaso Nirvadi Ranjanam Sanasyam, Shaguna Shanada Sapata Puja Kritavanam Chasadeva Netraksha. So here the Trifala, the various type of Trifala Prayoga and Rekta Moksha and Manaso Nirvadi, that means the psychological health is having a very much role in the ocular health also. That means the conditions like central serous retinopathy is totally dependent upon the psychic status of the patient. And Anjanam Sanasya, so the daily practice of Anjana, daily practice of Pratimarsanasya, daily practice of Padabhyanga, and daily intake of Krita and Trifala are very much preventive aspect in the management of cataract also. So in the cataract means it is nothing but it is a degenerative change mainly due to the oxidative damage. This oxidative damage can be prevented by the antioxidant therapy in modern also. So our antioxidant therapy is the Trifala and Krita. So give as a routine medicine. That means the Netra Raksha, Acharya mentioned that Trifala Madhusarpirpyam Nishi Netra Balayaja. So that is Trifala along with the honey and Krita. If it is age related, then we can expect the cataract changes after age of 55. So the start as a Nitya Rasayana to preserve the vision of the patient. And Acharya again mentioned that Ahida Dashanat Sadan Nivrutti Vrisha Bhasa Chala Sukshma Vikshanascha means means away from the Ahida Ashana. That means first line is the Nidana Parivarjana. That means Ahida Dashana Sadan Nivrutti. And Ukula means give minimum strain to the eyeball. So all these should be combined for a preventive ophthalmology approach. So these are the Pathya. I am not going to the details, and I think one session will be there. And these are the some clue about the management of Netra Roga in Ayurveda. So first we have to assess the dosha which is involved in the pathology by assessing the presentation of the patient, etiological factors, associated features, and all other necessary investigations. Then assess the underlying dosha. Then by assessing the dosha, we can categorize as a prabala dosha and anubandha dosha. So if it is, there may be vada pradhana pitta anubandha or pitta pradhana tridoshaja. Anything will happen. Accordingly, we have to make the diagnosis as which dosha is predominant and which dosha is associated. By this, we can select the drugs from this table. So if it is a vada pradhana, then we can select Erandamula, Devadaru, Shadaho, Saindava, Villamula, and Krida. For the local, this is especially for the local therapeutic procedures. So Krida is a good for the local application as well as the systemic use. If it is a Pitta Pradhana Vyadi, then we can select Draksha, Chandana, Musta, Ushira, Ikshu, Tutta, Lodra, Gairika, Daruharidra, Shadeva, Utpala, Krida, Kshira, Siddha, and Musta. All these are the category. From this category, we can take the medicines for the Sega. And if it is Kapha predominant, then Eshti Madhu, Maricha, Pipali, Shikripatra, Shundi, Shankha, and Madhu can be taken. So if a patient is having Vata Pitta Pradhana disease, it may be the Shushkakshi, then we can adopt the medicines from the Vata and Pitta group and convert it into a medium. That medium, if it is Vata and Pitta, there are two medium are coming in our mind, either the Krida or the Kshira. So if the patient is not able to tolerate the Krida, then go for the Kshira Sega. If the Kshira Sega is giving, then there is no problem for the patient to accommodate that Snigdhata which is present in the Kshira. And we have already discussed if the patient is having some sort of ulceration in the cornea, then the patient cannot tolerate the Krida. In that condition, we can start with the Kshira. So Kshira Kashaya can be used. So if it is having Vata Kapha predominant condition, that means the patient is having severe type of itching and edema, then we can select the drugs from the Vata and Kapha group and convert it into a medium. So that medium either be with a Madhu. If that is converted into a Madhu, then it becomes a Rasakriya. So that Rasakriya is a type of Anjana. Anjana cannot be given in a Amayukta Netra Roga. If it is having itching and shofa, it is Amayukta Netra Roga. Then convert that into a Sega form. That Sega means if it is Vada Kaphaja having predominant edema, then mix a Dhanyamla. Then Dhanyamla Sega that we can be adopted. So if it is doing in a closed eyelids, it is a Sega means it is doing in a closed eyelids, then we can opt for the Dhanyamla Sega. And if that condition is completely relieved, there is no edema and nothing is there, but itching is persistent, then that condition is indicated for Anjana. Then convert that medicine into a Anjana form, that means Madhu based form. Then it becomes, that is Shundi and Madhu, that we can start the Anjana. If that Anjana is start with Anjana, then that itching will be in the first stage. We cannot start with Madhu, but in the last stage, ultimately, if the Kapha Pradhana Vyadi is there, then the ultimate management should be the Anjana. That means it is the Madhu based medicine is essential to cure the Kapha Pradhana Vyadi. So either we can start it directly or we can start the medicine by resolving the edema or watering, and ultimately the Anjana should be done. So these are the broad spectrum medicines from which we can select the group of medicines and convert it into a media. That media is our choice. We can make Grida from this group, or we can make Kshira Kashaya, or we can use the Dhanyamla Sega, or we can make the Anjana, or we can make the Srida Shida Kashaya for the management of the condition. So as a general principle of management, Triphala is all indicated in all of the conditions Triphala can be used. So the Triphala is useful because as we know it is having Amalaki, Vipithaki and Haridaki. This Haridaki is very much Vadanilomanatu. So it is against, means it will prevent the Samprapti. As we have discussed in the first slide, it is the Apana Vayu Vaigunya will be corrected by the Haridiki. So if you are giving the Triphala for daily use, then it will prevent the pathology or Samprapti. So it is Acharya clearly mentioned that Triphala Madhu Sarpirbhyam Nishi Netra Balayaja means any type of diseases which is occurring due to the vitiation of Apana Vayu, that can be prevented by the daily use of Triphala. And Netra Kriyakalpa, accordingly, we have to do, just we have mentioned in the previous slide. And the Sega, Aschodana, Pindi, Vidalaga and Avagundana are very much useful in the Ama Yukta Netra Roga. This Ama Yukta Netra Roga, that means it is the diseases which is commonly manifesting in the anterior segment diseases. That means the conditions having conjunctivitis, keratitis, iridocyclitis or glaucoma. All these conditions the patient will have Udirna Vedanam Netram, Raga Shofa Samanidam, Karsha Nistoda, Shulasri Yuktam. These conditions will be mainly occurring in the anterior segment diseases. These conditions should be managed with the Ama Netra Roga approach. Means ultimately the treatment will be different, but we have to approach the patient with the Ama Yukta Netra Roga management. For that, Sega, Aschodana, Pindi, Vidalaga and Avagundana are highly useful. For example, if a patient is coming with allergic conjunctivitis, all these treatments, Sega, Aschodana, Pindi, Vidalaga and Avagundana are the treatment of choice. We cannot insist the patient for a Tarpana or Anjana. And the Tarpana and Pudabaga and Anjana, it is useful in the management of Pakkonetra Roga. Means when the Amavasa is completely over, the Anjana is a very good treatment. Means Atha Anjana Shuddhatanur Netra Matra Sremele Pakwalinge. Means this Pakwa Lakshana starts to appear, then the Anjana should be started. So if a patient is presented with allergic conjunctivitis, the best method or best treatment is Anjana, no doubt. But that patient cannot start with Anjana in the initial stage. Make that patient affordable for or acceptable for the Anjana procedure and start the Anjana in the late stage. That will be the ultimate cure for that condition. So it may take weeks. Means for the Amapachana, it may take weeks. Then wait for the proper Anjana. Then only the patient can be relieved from that condition. Otherwise, it will go into a longer and longer duration of the disease. And in the posterior segment diseases and degenerative diseases, Tarpana, Pudabaga and Anjana are highly beneficial. And we have already discussed in the retinal degenerative conditions or in the which is optic nerve diseases, the Tarpana and the Pudabaga along with Anjana is the very good line of approach. So as a broad, we can divide this Netra Kriyakalpa which into the anterior segment, management of the anterior segment as well as the management of the posterior segment and degenerative conditions. Okay, so, these are the presentation and these are the idea that I would like to convey to you by this presentation. And now I am moving to a few slides with taken from the clinics for your kind information. So this is a presentation. I think we can easily diagnose it as a Sirapidaga. So Sirapidaga is an anterior segment disease. There is no role of Pitta. No role of Tarpana here. We can easily manage with Aschodana and Sega. And this is also another case of Sirapidaga. That means Sirapidaga means actually it is an episcleritis or scleritis. In that condition, the local therapy, which that means is a Sega, Vidalaga and Aschodana only. By that we have to do, if it is that is a recurrent one, means then we have to adopt for the systemic management also. That means the Snehavana and Virejana along with the Jaloga may be necessary. And this is a case of Arma. In this condition, there is no role of Pitta here. It is a Shuklarma. So we can directly go for the Lekhananjana. But as our science indicated, if it is Drishti Praptam or if it is Krishna Praptam, that Chedyam Asita Praptam, if it is already entered to the cornea, surgery is the treatment mentioned in our classics. So if it is already entered into the cornea, then go for the Arma Chedana, and the remaining part of the Arma should be managed with the Triphalamashi or Lekhananjana. And this is a clear cut picture of the Avrana Shukla. Avrana Shukla means no sign of inflammation, only opacity. So this is a picture from the OPD due to the deep corneal injury. So deep corneal injury, we have to manage with the Lekhananjana itself. No role of any other medicines. Lekhananjana is the typical medicine which is applicable here. So that means Shankhanjana or Mudganjana or Chandrodevarti, anything that we can apply here. But the patient cannot tolerate this type of Lekhananjana for a long time. So in between, give a gap, give medicines means Kridavana and Pratimashanasya with Krida, and then again go for the Lekhananjana. So this is a patient having that is Pakshmashada. Pakshmashada means it is clear-cut jaloga is indicated, is Pakshmabaroda, and this is a patient that you already shown in the previous slide. That is a severe form of chronic allergic conjunctivitis with cobblestone appearance. You can see that is very much irregular and projected type of papillae from the tarsal plate. In this condition, if the patient is having a severe type of photophobia and lacrimation due to the constant rub of this type of follicles in front of the cornea. So the management is the Lekhana to make the tarsal conjunctiva smooth. For that, we have to go for the Pillaroga Chikitsa. And this is some sort of edema. You can see the edema developed in the upper part of the eyelid. So here the management is Vidalaga and Avaguntana along with the Sega, which added with the Thanyamla. No other treatment is required. So this is a picture that we have already discussed. In this condition, that is, it is a very much Lekhananjana indicated condition. That means it is a Vimalavarti or Shanmashikavarti or Akshabijadi Guliga that can be easily administered in this condition, because that all that conditions contain Myrija and Lekhana property medicines for the management of this type of Kavachakacha. So all these are the conditions of this subconjunctival hemorrhage. I think now need to explain much. It is very much easily curable by the Ayurveda, and this is a case of that is chalazion, and this is having another case of Amaja Netra Yuktara. That is actually it is a stay, but the stay is having some sort of cellulitis also. That condition, it is easily manageable by the Vidalaga. Vidala is a one and only treatment which is very much effective in this condition. And this is a severe form of that is scleritis. This scleritis means this patient is developed the scleritis due to the systemic involvement. That means it is due to the rheumatoid arthritis. So in this condition, the patient has severe pain, the pain and the photophobia. So this need a lot of time. It need time for the complete management. We have to give the Virejana, then Nasya, then Jaloga, then only this condition will be under our control. This is another case of edema, and this is a retinal condition. You can see the three pictures. When it's the first picture, the patient presented with the blurring of vision, and we observed a huge exudate in the macular area by the treatment. That means that we have admitted that patient and administered the Vasti and Nasya along with the Virejana. That this gradually, that completely remission occurred in that condition. Patient got full vision up to 6/9. So thank you. So this is the presentation from my side. I have included a general. In this presentation, I emphasized on a patient which is coming to our OPD, how to approach the patient in a general way, and what are the specific considerations that we have to treat some particular diseases like keratitis, iridocyclitis, and retinovascular diseases and glaucoma. So thank you one and all.
Namaskar, Shri Kumar ji. Myself, Dr. Hemang Shah, and I have some questions. One of my patient who is female, 65 years old lady, she had attack, decreased platelet count once 2 years back and recently 1 month back, and after that she was given treatment for dengue, but there was no fever noted. According to her, she was given some injections to increase her platelet count along with antibiotics. Her history is of mainly pitta predominant problems whenever she has uh, recently she came to my OPD and had a diminished vision, and she was complaining of foreign body sensation. When I saw her, she had severe corneal edema, and there were um iris deposits on posterior surface of cornea along with some blood stains and other things. There was no flare active inflammation not there on that day, and she had a 6 vision, and 26 vision. After so for that day, I thought that she might be having some dystrophy, corneal dystrophy, something like that, or she has already completed the attack of uveitis. So since I am practicing in Gujarat and Maharashtra, I gave her moxifloxacin antibiotic along with the steroid for some days, and then thought to see her again, along with some dilating eye drops, like cyclopentanol. So when she saw me after 3, and
Hello, your voice is not clear, sir.
Hello, Dr. Hemang Shah.
so you start with antivirals. However, I thought I want to deal with medicine, and since dominant diseases has history
Hello,
of
doctor.
so I thought to give her yes.
Hello, Dr. Hemang Shah. Actually, the voice is breaking.
So I gave Yakrut Balya medicine. Yes.
So I think, my doctor, I think we can make the discussion. I think if you can share the short history of the patient, then one more session is coming. Then that session we are including
Yes.
the case discussions. So I think if you can give some
Okay,
details,
okay,
then
sir.
we can include in the next, because most of the portions that we
Yes.
have narrated is missed
Within
due to your poor range, I think.
okay. Okay, just one sentence that she has decreased epithelial corneal edema. So I think it should resolve. However, I will update you, and
Okay.
thank you just for listening. And we will
Okay.
discuss this case later.
Yes, sir. You just narrate
sir.
that history, because maybe due to some systemic involvement, it may be developed. Means corneal edema means happen due to some systemic involvement also. So you just narrate, means detail the history. Accordingly, we can make a discussion over it.
Yes, sir. Sure.
Thank you so much, sir. Srima sir, it was a wonderful presentation. So there are few doubts in the chat box. I'll just read one by one of it.
Okay.
The first one is that, sir. In which condition can we use Anutaila and Shadbindu Taila Rasya in eye diseases?
Actually, Shadbindu Taila is clearly mentioned in the Shiro Roga, and it is having in the indication having Drishti Prasadana also. It is somewhat Tikshna in nature. Means it is having Bringaraja Swarasa like that. So as a Marshanasya, we can adopt the Shadbindu Taila, but as a preventive aspect, if we are giving as a daily practice, as a Pradimarshanasya for a long term use, we are usually giving Anutaila. Means for the prevention or for the preventive eye care, we are usually, means for the patients having cataract, to maintain or to arrest the progression of the cataract, it is usually mentioned in Ayurveda as the Pratimarshanasya and Anjana. So we are giving the Kajayapana Anjana or Ilanir Korambu Anjana along with the Anutaila Pratimarshanasya. Means the patient cannot tolerate or afford or cope up with the Shadbindu Taila for a longer time. So for a short duration, we are giving the Shadbindu, but for a long term and daily use, we are giving the Anutaila.
Thank you, sir. So another question is that in case of, sir, can you please tell us some examples of Tikshna Nasya which we can use in open angle glaucoma and dry ARMD?
Tikshna Nasya means usually means according to the condition of the patient, means most of the condition that I have elaborated, but in clinics it is very difficult. It is very easy to speak, but it is very difficult to administer. Actually, if a patient is having Pitta Prakriti, we cannot give the Tikshna Nasya for a longer time. Means, for example, we are giving that Nimbasava Nasya. It is one of the very good medicine that is we are practicing in our OPD. Shigri Bija. That means Shigri Bija, which is crushed and made into a pottery and which is dipped on the Nimbasava for the whole night, and the next day morning we are squeezing it and using it as a Pradimarshanasya. So it is very good Tikshna Nasya. Means for example, for the it is giving only in a small dose, means maximum 2 or 4 drops that we are giving, and it is very useful in all the type of Srodharodha. But one thing we should keep in our mind, that if the patient is having severe Pitta Prakriti, or if a patient is having a habit of exposing to the sunlight or taking very spicy items, there is a high chance of nasal bleeding is there. So we cannot give the Nasya for a longer time, and this is a very good medicine, that is the Nimbasava Nasya along with the Shigri Bija is a very good medicine. And Shiro Virejana Gana, which is mentioned in Ashtanga Hridaya, that means Vidanga, Shigri Bija, Saintava, Marija, all these medicines are included in the Shiro Virejana Gana. So we can make the powder of the Shiro Virejana Gana, and accordingly we can convert it into a media that can be simple distilled water itself, or maybe to make more Tikshna, it can be converted into an Asava form. Like that we can make. Or all type of Swarasa Nasya, that means Prathamana, not only Prathamana, is Avapitaga Nasya. Avapitaga Nasya is having a property of Shodhana in nature. That means Shigru Swarasa or Tulasi Swarasa. Means Swarasa Nasya all are having a little bit Shodhana in nature, means Tulasi Swarasa along with the Saintava. So to make it more Srodho Rodha Shamana, we are adding Saintava to it. So the medicines which is added by the Saintava will make it as a Tikshna Nasya. Either we can use the Asava based medicine, or we can use the Swarasa based medicine, or make the Shiro Virejana Gana to an appropriate media except Krida and Taila, and we can use for the Tikshna Nasya.
Okay, thank you, sir. So the next one is that, sir, in case of ARMD, you've already mentioned that we should give a Srodha Rodha Chikitsa and then give Tarpana Chikitsa. So how can we know that the Srodha Rodha is removed, and when should we start Tarpana?
Actually, there is not a clear-cut demarcation. We are depending upon the patient's response to the treatment. So in the case, actually in a dry IRMD, the patient usually will not have a gross loss of vision. Wet IRMD is having a sudden onset and means a huge loss of vision will be there. It's marked loss of vision will be there. But in a dry IRMD, the patient will develop the drusen for a long-term course. So for a long-term course, it is our treatment approach. Our treatment approach means if you are giving a Tarpana treatment or a Brahmana treatment to an organ, to start with Lenkana, that is Brahmhyastu Mrutu Lenkayet. It is a general principle. So if you are trying to give a Brahmana treatment, it is very good to start with a Lenkana treatment. So that Lenkana treatment here that we are adopting as the Nasya, and that Nasya will be of Tikshna type, and that Tikshna Nasya will help to remove the Srodorada and to accept the Tarpana more effectively to the nervous tissue. So as a first course of treatment, we will give a Marshanasya as a Tikshanasya, and then starting the Tarpana. So by the assessment of the convenience of the patient, and we know that if we are giving a Lenkana or Tikshna medicine, there will be a Samyak Lakshana will be there. Please, if the patient came to the Samyak Lakshana or the patient is having some difficulty to tolerate that Nasya, then we will stop that Marshanasya and we will continue as a Pratimarshanasya, and after a period of around I think 15 days, then we can start for the Tarpana and just complete the single course of Tarpana and assess the patient, because this is a long-term disease and we will convince the patient that this may require 2 or 3 sittings within a gap of 6 months or 1 year. So just assess the patient after 6 months, then we can see that how the treatment is effective to cure that condition. By that only, by the experience only, we can understand the condition where the Tikshanasya should be stopped and where the Tarpana should be started. And if wrongly, if we will start the Tarpana, then the patient immediately will complain of there is something blurring of vision. Means due to the Adhisnigdhata, the patient cannot appreciate the good health. That means Avira Darshana will be there. So to remove the Avira Darshana, the good treatment is to go for the Tikshna Karma.
Thank you, sir. Sir, the next question is that, sir, what is the prognosis of retinitis pigmentosa through Ayurvedic treatments?
Actually, in the beginning itself, I told that most of the conditions in the eye are asadhi nature, and the retinitis pigmentosa, we have to first assess the Sroto Vaigunya by the family history. If there is a strong family history, it is very, very difficult to cure the condition. And if there is a history of consanguineous marriage, it is very difficult. And the age of presentation and the presentation of the patient at the time of condition of the vision at the time of presentation, all these are very, very important. Means I think I have one patient, she presented at the age of 36 with the 6/12 vision, and when she from the allopathy side, they told that her vision is going to be deteriorated within 5 years, but the patient is still under the treatment with the 6/12 vision. The vision is a single line of vision is improved, but she is very comfortable with the vision, and vision is maintaining. 6/12 vision is still here, but the patient is having some dark adaptation problem is there. Cannot manage that condition. The condition is very, very challenging, and we can offer the maximum to the patient, but we cannot ensure the complete restoration of the vision in some of the cases like retinitis pigmentosa. Actually, the patient will start the treatment with good vision. The patient is presenting, and we are starting the patient treatment in a good vision status. Then it is definitely that we can restore the vision.
Sir, have you found the increase in peripheral vision in such cases?
Yes, actually means when a patient is presenting like this, then it is very important to assess the prognosis. Means if you are treating the patient and if there is a strong consanguineous family history and the as per as the patient history is giving the vision is deteriorating as a sudden, then we have to wait and convince the patient about the management. So if we are taking the perimetry, if the patient is having only tubular vision, that means the patient is in an advanced stage. Otherwise, the patient will have an annular scotoma. If the patient is having an annular scotoma, then we can easily manage that condition. But if the peripheral area is lost, then we cannot do anything. But the somewhat, if it is not reached to a end stage, then definitely the peripheral vision will improve. The vision will improve and the patient will show its improvement in the perimetry also. But the main problem is that I have faced that the patient cannot completely recover from the dark adaptation. That means in the evening time, the patient, whatever may be the improvement that we have got in the clinics, this dark adaptation somewhat a major problem for the patient. But the patient is satisfied because as per the history from the many of the doctors, the patient lost the confidence that she or he is going to lost his vision with the coming 5 or 6 years. That we can definitely restore, and we can up to a certain extent we can improve the peripheral vision as well as the quality of vision.
Thank you, sir. Sir,
have you found any change in color vision in such cases?
Actually, the color vision means actually this is a retinitis pigmentosa is a disease of the rods. Disease of the rods means rods are not having a function of color vision. Cone cells are very much important in the sense of color. Actually, if it is not advanced, means actually retinitis pigmentosa is a primary pigmentary retinal dystrophy which affects rods more than the cones. Means cones can also be involved in the pathology, but only in a later stage. That I have already mentioned that if the patient is coming in a later stage with only tubular vision and very much decreased in vision, it is very difficult to cure. But in most of the cases, if the patient is having comfortable vision and early presentation, we can improve the quality of vision. Quality of the vision means quality of the contrast, quality of the peripheral vision as well as the color vision.
thank you, sir. So the next question is that, sir, what is the prognosis of cases in case of blindness following neonatal oxygen toxicity? Is there any chance by which we can regain